we've already checked our boxes and can say, this, this has been in front of Shaq, this has been in front of the director of research, they have given us these suggestions, we've implemented them, all of that good stuff, and then we can go to the board. If the board then gives us permission to implement the survey, what we envision is it going out on Skyward and being emailed to all of the parents and guardians within the school district, all ages, because just because you don't have a middle schooler or high schooler now doesn't mean that you're not in a year or two. So we're just trying to get the accurate feedback from the entire NEISD stakeholders. And once...
As a taxpayer and community member, I'm out of the equation because obviously I don't have a child enrolled in NEISD schools. Whereas maybe Sean might have someone who's a basis or San Antonio Christian School, where this is strictly going to NEISD people, even though everybody pays taxes for this district. We have no say in our community values are not into this because we are not enrolled.
Debbie, I'm sorry to do this. Do you mind standing up?
It's gotta be on mic.
We don't have
a handheld one.
We don't have a handheld. Thank you, Debbie.
Sorry, I've got it.
Because you said that a lot more eloquently than I could have restated.
Do you want to bring a chair?
No, I don't. Old senior citizen as it is. My point is that, okay, from the get-go, I verbally, I guess, understood the point of this. Well, I mean, I understand the point. We're trying to get feedback from the community. But community is not just anyone who attends an NEISD school, okay? My kids have graduated, but I'm a member of the community, so I should have a say in it because I'm also a taxpayer for the district. Maybe I'm barking up the wrong tree here. But then also, you're just gonna send to NEISD people because my concern was originally, I thought it was gonna go to the whole, anybody who resided in the district, paid taxes in the district, so on and so forth. You've got kids who may be enrolled at Basis or San Antonio Christian or whatever. And again, that's gonna like, not nullify, but it's going to change your results, obviously, of the survey. So I'm just curious. So basically, this is just designed for people who have students at NEISD.
Students at NEISD, because the curriculum is going to be taught to the students at NEISD.
Okay, so it's NEISD community values, not, I'm sorry, how am I saying
No,
that?
it's just parent values.
It's the
Yeah.
parent
Yeah,
values
it's parent.
of...
It's
not
parent,
the
yeah.
community values. It's just the parent values.
Sure.
Just go to
If
mic.
you'll
Just
please.
use the mic, please.
I know, it seems like it when you're there, but you're actually not.
I just wanted to, I have to go there?
Yes, please, at the podium.
Sorry.
I just to I thought maybe to ease the concern of community values is also who we're electing as to represent us in the school board, right? Doesn't that also kind of help solidify the community values that are being represented?
Yeah, and the whole idea is to gather feedback from the parents and the guardians who have children within the NEISD, and then our job from the SHAC is to present the information that we've gathered. We're doing the heavy lifting, and then we're presenting the information to the board of trustees. They're the ones that have to make the decision, and so we're doing the heavy lifting for them. We're going to present this from the SHAC, as these are our recommendations based off the information we're getting. This is what we think that we believe as a SHAC, the direction we should go, and then we leave it up to the board of trustees to make their final recommendations and their vote.
And if I may, Tony, just to Debbie Freno's point, there will still have to be 2 public meetings before any recommendation can be made from SHAC to the Board of Trustees. So there will be that opportunity for community outside of parents to be able to do those things.
Basically, the survey is one more step, hopefully in the right direction, to help the Chase Committee recommend to the full SHAC, and then through the full SHAC recommend to the Board of Trustees the best possible curriculum people don't realize that the rules have changed, that stuff has been added, and there are certain requirements that, you know, we have to, by state law, teach to the kids. And I don't know if Basis and Great Hearts, their charter schools, I don't think that they follow the same or are required to follow the same. I don't know. Therefore, they're, you know, if they want their children to be taught this information, then their kids should come to Northeast. Yes, Ron.
Ron, do you mind using the podium, please?
Yeah.
And anyone else who wants to speak after Ron, go ahead and get behind him.
So the point of clarity, I'm actually seeking a point of clarity on this to her point about community values. If my children were all in private school, even if I lived in NEISD, I would not be able to serve on the shack, correct?
That's correct.
So we have community members in other communities. We've got religious, we've got corporate, we've got nonprofits here. So as far as who we're seeking out with this survey to see what's taught in the school, like you just said, Rachel, the kids are in the other parts, or people don't have kids directly in the school, then they can come to the school. So I am correct in understanding for everybody here that this is about the parents and what's being taught in the schools for the kids of the parents in the schools, correct?
Of the parents of the kids in Northeast
Okay.
via state law.
Now, granted, we do have community members, such as Debbie and Sean, and so it's part of the outreach, and that's the reason why we say community values. And we're not trying to narrow it down to just NEISD. And so we do have, yes, and so actually, to your point, you could have children that go to Basis, but because of whatever your expertise is, someone may have nominated you or asked you to be a part of the shack.
So that clears it up for me pretty well. As far as doing survey research, and I think the research department will get back to you guys about this. But to Debbie's point, we could actually still send a survey somehow if we could get access somehow to have a public dispersal of this. The only difference would be in culmination of that data, we would have to separate who is in the school district and stakeholders in the school district specifically, so the parents, and as well as the community itself, so that we can see all angles of it.
And it's, even if this is not approved at or by the Board of Trustees, we still have to have 2 public meetings that are open to the public.
And that would allow those
And
community
we,
members to come.
exactly, and we can use the, you know, even if we're not sending it out directly through the parents, we could still use, you know, we'll have a much smaller pool if we do it that way, but it's just one other means of getting additional input on, you know, the questions.
So, and I'm gonna end with like, this is my mindset to ask these questions, Debbie. More data is good, so finding a way to get more input would help us make a better decision, regardless of where it comes from. So, thank you.
Sean?
So maybe, Jennifer, for those of us that don't know, how do those public meetings get communicated out so the community knows that they're happening?
Well, considering it's new and we've never done it, I'm open for suggestions. I am certain it will probably get, well, it will definitely be on our website, of course. I think everybody sitting in here is gonna be a big, we will communicate it to all of our campus principals. I'm sure it will be a story on every social media account we have in Northeast. We will just promote it as best we can, through principals, through PTA, through every avenue that we have, Facebook, website, all of that. Great question.
I think Sean's asking.
You're talking about a survey.
Talk.
Absolutely.
Survey on sex ed.
CDC could write in the bulletin.
On community values.
Oh, okay.
Well, and if you actually have looked over the questions, you'll see that we're asking for best time to hold those public meetings, whether it is afternoon, evening, weekend, weekday, that kind of thing. So that is one of the questions that's on the survey to help us determine and be able to offer the public meetings to more people, more access. Are there any questions about the actual survey? Okay.
Topics of the survey on sex ed.
Sorry.
Community values on sex ed.
We will make sure there's a handheld mic next time.
The one that was added on the Q9, I just want to clarify it. So you want this one semester to be only offered in high school for graduation? Because as it is, you have to have a high school semester of health to graduate. That's not.
That's a Northeast requirement, that is not a state.
So what is the
that-
question that they're asking here then? It has to be taken in high school? Because you can take it in 8th grade and it counts as your high school health.
And the reason that that one is blacked out on the sheet is because that, we want feedback on whether or not to include that question on the survey. So that is one thing, if you haven't had a chance to look at question 9. We would like the first 8 for certain. 9 is, okay.
So again, so you want it to have to be taken in high school because you already have to take it to graduate.
Hi, everybody. So question 9, right now as is, Northeast does require a semester of health in high school for graduation. The reason I know I suggested this question is because I've had feedback from parents that have said that this semester is very hard for their student because they're having to fill that other semester. And so they would kind of like it not to be a requirement for graduation, but it could still be offered, of course, but not an actual requirement. So that's kind of why I thought it might be good to get kind of community feedback since we're doing this at this time. Not to say that we would do anything with it like immediately, but it might be good information for the board to have moving forward.
I have a handheld mic now. They were listening. Thank you, Jennifer, to the rest of you.
That was media services.
Thank you, Media Services.
If it's not a requirement,
It's not.
Come on, this is not
it's not a
America.
requirement, but how do we teach the TEKS? Because the TEKS are a requirement, so then how would that?
If you offer the course, you have to teach the health TEKS.
So if you don't offer the course, you don't have to teach the
Correct. And so in Northeast ISD, we require 1 semester of health for graduation. In middle school, health is required curriculum. It's part of the required enrichment curriculum. So students still we would be required to cover the health TEKS in middle school as we currently do. But Northeast chooses to require 1 semester of health in high school for graduation. Does that help?
So middle school, it's more of the maturity, which obviously they need from the health standpoint. What NEISD does on top of that is requires it for the high school level, because obviously your body's changing a lot more in high school than it is, and there are other issues that you have to consider than at the middle school level too.
And this may help. We would still offer, I'm assuming, we would still offer health as an elective class. As part of the elective class, we must teach the health TEKS. So if we offer the class, we must teach the TEKS that coincide with that class in high school.
TEKS aren't, like, the state does not require, like, TEKS is required for 2 weeks plus to all children. Like, they're required TEKS, but they're not required to offer it. Like, I've seen health TEKS are required to that, as part of state law. That when they're not required,
They're required in middle school as part of enrichment.
not required in high school.
They're required if you offer credit for health. You cannot award credit for health without covering the TEKS.
So then so again, like, so then would be offering another optional, like.
It would be an elective course.
An optional elective, you can opt in, but then you can opt into the health class, and then you can then opt into the sex ed.
Correct. And the only place you would have an opportunity to opt into sex ed would be through the elective health class.
If it's, right, if that were to change at some point down the line.
So again, just a point of clarification on this. And I'll go to yes or no questions. So in junior high, Texas state law does or does not require sex education? Does, but it does not for high school. If you're going to offer it for high school, it has to follow the TEKS. But it could be opt-in. It's an NEISD requirement to, right now, to graduate, but it's not state law.
Correct. However,
And to clarify, he asked about sex ed. That's not the same thing as health.
Okay.
Okay.
Yeah, in middle school, clarification. If you'll clarify that.
Okay, so health is part of required enrichment curriculum for the state of Texas, for middle school. So, but we have flexibility in what grades we cover that. So in Northeast, we do it in 6th grade for 1 semester in 6th grade. That's where we cover it. That's the required enrichment curriculum. In high school, it is not required by the state of Texas to have health credit to graduate, a half credit. Northeast ISD has, for as long as I know, Katie maybe will speak to it more, required a semester of health in order to graduate as a graduation requirement. And yes, you can take it, this is mentioned, in 8th grade for high school credit. So you can do it there. So some students take it in 8th grade in order to check off that credit for high school.
I just want to confuse TEKS requirement to state law. So if you're opting in to take it, if you're opting in to take it, you have to follow TEKS, but that is not the same thing as it being required by state law for high school.
No, not exactly. The TEKS are required for the course, in the course. So if you're taking the course has to teach the TEKS.
If you're taking the course.
If you're taking the course.
So I just want to make that point of
have to
clarification.
take the course, currently the way Northeast does it, you have to take it in 6th grade. You do have to take it in middle school at some point. Northeast does it in 6th grade. A couple of the questions on here are asking if we should have opportunities for students to be taught some of these new TEKS in grade 7 or 8. So again, if you look over the questions and have questions specifically about that. And then back to high school. Yeah, my son did his high school health in 8th grade so that he could, just go on and keep on going. So that wasn't that big of a deal. But with the new violence prevention and the sex ed abstinence requirements and everything, just keep in mind, those by state law now. Now keep in mind, Northeast always did it this way. The state has now adopted what Northeast has been doing the whole time, which is an opt-in policy versus an opt-out policy. So if you're opt-in, you have had to sign the permission slip as a parent or guardian for your child to receive that particular instruction. If you don't sign the paperwork, you forget to send it in, you don't provide, you don't want to do it, your child won't receive those particular opt-in portions of the education. So, if that helps make anything more clear.
Are we getting feedback now, or is this a written feedback? I guess the only thing I wanted to just quickly say was, just from this short discussion, will there be any additional information alert beforehand? Because I guess to me, I would not be a very well-informed parent. Trying to understand all this seems a little more nuanced than I realized. But I guess in regards to question number 9, if I'm not there yet as a parent with a junior high or a high school, I have no idea how to adequately answer that question. I guess is what I'm trying to say. Probably even for some of these other ones, if you just have little elementary age kiddos, you're going to have a hard time. And I guess I just wanted to put that out there, that kind of how we see with the SHI, the Student Health Index, where we're like, I wonder if that data is as reliable, because some of these parents are not necessarily going to understand all of these nuances
I think that's a good point, because from my standpoint, before my kids were in high school, I would have looked at this and thought, oh, hell, that's great, we want them to have help, this is a great requirement. And now that they're there, we're seeing why other people are so frustrated with this. So my son's got to either drop in athletics or drop in honors class in order to squeeze this in, no matter what grade he does it in, whether it's an 8th grade or not. And that means either potentially losing his spot, some takes on a GPA or whatever, or dropping out of sports, which is near and dear to him for this. So I have friends that sell a shack in Lubbock, where I was from. They offered this a few years ago as an option, and they didn't even have enough high school kids in the entire city to have one class. And I hear that's happened elsewhere too. But it's just something to think about. We mandate it right now. I do think it's worth leaving on here. And whatever you guys want to do for the discussion on this, we want to do it today or in writing, let's do it. I think it's a good thing.
Go ahead, Ben.
I just wanted to, I liked her point, I'm sorry, I don't know your name, I'm Ben. I hear her point about we might not understand what these questions are asking, or if parents not as educated with it as we've become, having a preface, right? And that's where Rachel came up with the paragraph on the bottom to give a little bit of lead into it, and we did try to, we had a little bit of collaboration via email back and forth kind of this week on it, and everybody chimed in. We did try to make the questions almost give a little bit of background, like if you look at 4, for example, where it says, in addition to offering the opt-in HSE in 6th grade in high school, because that's the status quo, should we also in 7th and 8th? So I guess the delicate balance that we're concerned about is getting enough engagement to where we get a healthy segment of people that actually take the time to answer the survey, because I feel like if it's overly long and overly worded and takes too much time to get through, people aren't going to bother to do it at all. So there was sort of a fine line between how do we keep it simple but make it, that's kind of why question 2 and 3 are even on the survey, was to make sure that the parents even know, hey, I can go and view the curriculum that they're teaching my kids, and where to find it. Because right now, I didn't know that prior to being on the shack. I didn't know that. So we want as much feedback as we can get to make this, engage a high amount of participation, but also give enough information. And to the point about the community, right, versus community values, right? Obviously, we do want to reflect the entire community's values, but I think specifically with this, the idea was to go through the Skyward channel and the parents was because the parents are the ones directly affected. They're the ones having to opt in for these lessons, since they are all opt-in lessons. And also it keeps the feedback genuine, to we know that everybody that responds to it is an NEIS, has a vested interest in NEISD other than just their tax dollars, right? Because we all pay taxes. But this will directly affect our children. So that was kind of the intent. We want to make sure that the respondents are, it would be difficult to get it to the whole community abroad, what would be the delivery method and how would we be able to verify that whoever is responding is indeed part of NEISD.
And to your point, like you said, as a young parent or a parent of young children, you haven't thought about this process yet. And so to get this type of flyer and go, like question 2, did you even know that NEISD teaches this or where to find it? And so we're trying to help educate the parents so that the parents or the guardians are making educated decisions on and giving feedback to us.
To Anna's point, I think when we're making this, we've been sitting, our committee, Chase Committee has been sitting here, we've been hearing this stuff from Jennifer, who's a really patient, great teacher, teaching us all of this. But parents, when they get this, are going to be like Anna said, like, what? So I'm almost, what kind of flashed in my head was like, maybe we have someone do like kind of an informational video that goes out with this to kind of explain the structure of this, kind of give the parents like just a quick 411 on how this works. Where to next?
grader just turning in course cards that just learned that he has to take half a year of health. Maybe if we just change the wording to say, should continue to be a requirement, so that people that don't have high schoolers or 8th graders about to be high schoolers, so a little easy, but I think it adds a little explanation to others.
Yeah. So, I want to give credit to the Chase Committee for coming up with this. I think it's a really good survey. And I think it will do a lot to really bring that transparency with parents. And it's always good as a parent to feel like you have feedback and you're being heard. So my question is kind of around the elementary school question. First of all, will it be an anonymous survey, or are you going to keep track of like the emails?
That's a good, I mean, I don't know, so, hold on.
As far, yeah, I'll give it right back to you. As far as doing blind or doubled up blind surveys, that's gonna be up to the research department. That's the question, when I asked you, that's kind of what I was getting at. So that's gonna be a more, back to her question of procedurally, how's this gonna be done? And I do absolutely think it should be anonymous from the parents. At least to us.
It can be anonymous if it recommends
Valid point. So,
But think you could blind the emails, but it's not.
Well, we don't have to.
Well,
Right,
So
and if they just give us the Qualtrics or the information that, you know, how these questions were answered, percentages, that's all we need. We don't need to know who did or didn't do it, who said or didn't say anything, who had other, you know, things to add to question 8, you know, other than just a list of that kind of stuff.
Almost by the very nature of going to Skyward, it might change people's perception and answering questions in such a way or not, right? So
Well,
I can't hear. Mike?
Yeah, I'm sorry.
No, I'm just saying if it, by the very nature of being attached to Skyward, it may influence the way parents answer the questions. So they may not know that we're just getting harvesting percentages and that's all we're seeing. They may think, oh, I'm going to answer this way because I'm just.
Again, it's a procedure question, but it may be that we could have it on the website, doing an email blast, that parent could then print it, answer the questions, not put a name on it, and then have their student take it in to whatever classroom, and it would be as anonymous from that standpoint. We don't have a procedure yet, but I mean it is a good question, but there are ways to get to that anonymity.
So then the other thing that I was thinking is, would it be worth it to consider a question asking, my children are in the following grade levels, so elementary, middle school, high school. That way you can look at the data and say, okay, this is of concern for elementary parents compared to high school parents. I don't know if that would be valuable.
That's a great question.
I like that.
I like that.
Yeah.
And somehow, other question that gets to the question of if we're putting this survey out and get access to, you can have the community thing. Do you have a kid do you live in the school district? Do you have a kid in the school district? Oh, if they are the kid in the school district, what grades are they? Because that would get to the community input as well. That they don't necessarily have in any of the school portion of it.
And then, really just around the verbiage on question 1, I had a question, example 2, it should teach young people to wait to have sex. I noticed that there was not, the term emphasized abstinence, and I was wondering if that was intentional.
No, it actually, the actual real answer to that is we were lazy, and that question we copied from a UT Health example questions sheet that was actually brought to our last committee meeting to brainstorm this. Question 1 is almost verbatim taken from that, so I actually had the same thought on that, and I do agree that that should be changed to meet the verbiage in 2004 to say emphasize abstinence also.
I think she was next, and then we'll go back to you.
question 9, but I think it's hard to interpret. So I think maybe we could say Texas law does not require health for graduation. NEISD does require a semester health class for high school graduation. Should NEISD continue to require for graduation or offer as a semester elective? You could play around with the last bit, but I think like a little lead in to what is required and what is not required helps clarify that particular question. But I do like that question because I as well would have the same problem with what does my theater, choir, sports oriented child do where they have semester that she has to figure out in high school.
Okay.
Thank you.
So we talked a little bit about the response rate and engagement, and will the it seems like we're talking about the questions on the one hand are not necessarily crystal clear for all parents who are not already engaged like we are, but on the other hand, they're also already long and wordy, and should we add a video to it? And adding a video, making the questions longer will all decrease your response rates. So one of the things I wonder about this is, it feels to me like there's a lot of different topics here, and it's not really crystal clear what is the objective of the survey. And maybe we could get a better response rate by really focusing on what's the answer we're really trying to get to, which really seems kind of like the first 3 questions, and not trying to put in other filler. Especially when I look at question 4, question 5, question 6, what I'm hearing is that there's one semester-long health class in high school, of which there's probably like 4 days that are sex ed. But in those 4 questions, it makes it sound like that content is every year, which is, or maybe it's more than 4 days, but it makes it sound like it's every year. So this question kind of reads like every single year you're going to offer these lessons, which is not what it sounds like we're describing. Sure.
I can answer that. So to the point of what are we trying to achieve with the survey, and that's going to be a major question that we expect the board to ask. What we're trying to achieve, so in Chase, yes, we have the task of selecting a curriculum, but we also, as a SHAC and under Chase, we also have the responsibility to make a recommendation on is sex ed taught at all in 7th and 8th grade. So currently it can be taught in 6th, 7th, 8th, and high school. Right now as a district policy, it has to be taught in 6th and high school. It does not have to be taught in 7th and 8th. So we want to know if parents want it to be made available in 7th and 8th or not at all. Wait from 6th grade till high school to have a repeat of sex ed. And question number 6 is important because with the sort of overlap of the TEKS for violence prevention, those sex trafficking, child abuse, family violence, and dating violence is likely going to align and be taught in the sex ed program. So if they want more frequency, I guess we want to see the parents want more frequency of teaching sex ed and violence prevention or violence prevention, that's why it's 2 questions, in 7th, 8th grade as well as 6th and high school, because right now that's a recommendation that we're going to make also, should it or should it not be taught in 7th and 8th grade. So that's why basically what we want to know is the things that we have to decide. We want to, do we teach it at all in 7th and 8th, because there are different 7th and 8th grade programs. There's, some of these programs have 6th, 7th, 8th, and high school different programs. So do we need to review them all as a standing committee, or do we just need to review 6th grade and high school? And then additionally, we want to know, is contraception going to be taught, and at what level? If we do 7th and 8th, is 7th and 8th going to include contraceptive? That's why question 5 exists. Question 2 or 3 actually are not the info we even want. Those questions are just there to make sure that the parents have kind of an understanding of what the rest of the survey is about. So really, if I was going to say that any questions were the meat and potatoes of what we want It's questions 4, 5, and 6.
And please keep in mind, because these are opt-in lessons, parents and guardians know their children better than anyone. And a 6th grader is, in a lot of cases, more closely emotionally mature, like a still elementary school kid. But literally in that 2 short years, going from 6th to 7th, 7th to 8th grade, they go through so many changes and so much stuff happens to their bodies, to the topics that are being discussed on their social medias, the kids that, you know, even the good kids that are, you know, doing good stuff on good grades, honors, they're still going to talk. They're still going to have those conversations with their friends that, you know, they think that, oh, you know, we're the first people ever to have these conversations, not knowing that we did the same stuff 20, 30, 40 years ago. But because they're opt-in, you may decide your 6th grader does not need to have the sex ed information as a 6th grader. But as they mature over that next year, 2 years, 3 years, that information may be important. And just because you opted out the first time around doesn't mean that you might not want them to have access to that kind of information and education going forward. So that was also where we're coming from, you know, from this, because it's still up to the parent whether or not and when or if their child gets these particular topics taught. At school, yes.
Dead battery.
Uh-oh.
Okay.
Do we have a dead battery?
Okay. Kind of piggybacks on what you were saying.
Okay. Oh, I got it. I just needed you to bump into a chair first.
It kind of piggybacks on some of the questions and maybe the redundancy and things like that. I guess some people may not understand, and maybe I'm trying to understand, if I say, yeah, get it in 7th grade, yeah, get it in 8th grade, does that mean I just added health class to my kid? No. Okay, good to know. How would they get that program then?
That would be as a supplemental within the English class. They would bring.
Oh, no.
I'm sorry.
Not that one.
Okay.
Not that one.
Okay, that's.
Sex ed is currently taught 7th and 8th grade as part of PE. Well, it's not being taught this year, of course, because it's on pause, right? But in the past, it's part of PE. So the kids who opt in will get it from a health certified PE teacher. Most of our PE teachers are also health certified. What you were talking about for English is guidance services often does guidance lessons through the English classes, and there was consideration of topics such as prevention of child abuse, because really prevention of child abuse isn't much in the health TEKS. So they go in and do, obviously our counselors are better trained to talk about some of those issues, right? So that's what he meant when he referenced English classes. That's where our counselors do guidance lessons. But that was the change. Thank you, sir. That was, okay, so that was both Chase and Safe and Healthy Schools talked about how they shifted those TEKS back into health. That was where it was. Are the counselors going to do it? Are we going to do it in health? And so the safest way was to make sure violence prevention is done in health as part of the health TEKS.
So right now, there's no sex ed in 7th and 8th grade PE.
Right now it's a no grade because it's not being taught yet.
In a normal year.
In a normal year, it would be taught in 7th and 8th grade. It would be, you would have the option to opt your child in through PE in 7th and 8th grade.
So maybe question 4, you give that contact. Would you like us to continue? Do you like this program? Because I had no idea that was there. So would you like us to continue the opt-in sex ed curriculum through 7th and 8th grade PE instruction?
Well, that's the way the question actually phrases. It says, it's currently an opt-in in the 6th grade.
Right.
And any ISD should offer this in the 7th and 8th grade, and then you tell, yes, I strongly.
Continue to offer.
Oh, continue. Okay, we can add the word.
We feel like it's not there.
So the comment was to add should continue to be taught in 7th and 8th grade for a question for.
And don't worry, Diane over here is making all these notes. She's our wordsmith.
I just wanted to add one point of that because it popped into my head for the shack. At least we're all gonna, even though Chase, we're reviewing the curriculum, shack has to approve it all together, right? So if we do continue to offer in 7th and 8th grade through PE, because it is PE and not health class, that instruction does not have to meet TEKS in 7th and 8th. 6th and high school do because it's health classroom. 7th and 8th, because it's PE, that's another part of our consideration process, is it does not necessarily have to meet the TEKS in 7th and 8th grade because it's not a health class.
So, to give an example of that, and that kind of led to another question that they had. So if we're teaching it outside of a health class, right, then it's just an optional enrichment program that we're offering in 7th and 8th grade for any parents who want their child to get it. There are new TEKS in health to talk about STIs in 7th and 8th grade, and I think Katie, correct me if I'm wrong, perhaps even talks about contraception in 7th and 8th grade. If you all were to say, yes, we want, we would recommend that we still offer this opt-in instruction, but perhaps, based on this survey, the community doesn't want to cover contraception in 7th and 8th grade. We could do that in 7th and 8th grade because we're not tied to the TEKS, because this is an optional program, it's not our health course. Does that help that make a little bit more sense? When it's taught in a health class, we have to follow the TEKS, right? But our health class is 6th grade, not 7th and 8th. So we currently, just again, I say currently, everything's on pause, but before this year, sex ed is offered as part of 6th grade health. It's offered opt-in 7th and 8th grade PE, and it's offered as part of Health 1, whatever your kids take that. Whether they take it in 8th grade for high school credit, or they take it in 9th grade, 10th grade, 11th grade, 12th grade, okay? Does that, hopefully that helps.
So, I just want to say that this has all been great. I think healthy discussion, and we've taken some notes. Thank you, Diane, for doing that. Taking those notes to where we can tweak a couple of the questions. But again, this is what we would like. Our Chase committee has worked really hard and going back and forth, trying to get the wording correct. And but we wanted to roll this out and present it to the board for their consideration.
And our deadline for getting it on the board's agenda is today. So, okay, but that being said, that doesn't. Okay, yes.
The question was, can we get on the agenda without having finalized the questions? I have reached out and said we are trying to finalize the questions we're working with, and so they know that we're working on them. I will be, by the end of the day, presenting the agenda item, asking that we be on there, and can you give us maybe a day or two to finalize the questions? So I have asked that.
And if we could send them out, the new questions and wording as has been suggested, we're going to meet again, Chase will meet again on Friday. We can then get that emailed through via Jen. We can get that emailed out to all of the shack members for, and I think maybe can we do like a Google,
I can do anything you want, ma'am.
One of those Google things where you can, do you agree or disagree that, we should present these to the board?
You want a poll on the email?
Thank you, poll, that's what they're called.
So we're going to poll whether we want to poll. I got you.
Okay, don't confuse me.
And just to point out, since the Chase Committee is meeting every Friday, so it's possible for us, if we could get this, I don't know how fast it can happen, but We meet Friday and we meet next Friday, which is 2 meetings before the board. So we have the opportunity to tweak some of the comments we heard today, send out an email, get feedback, and then the Chase Committee will meet again, put that input into this to be presented to the board. So we've got, it's crunch, but we've been meeting every Friday anyway, so but we've got time to get the full input from the full shack into these questions.
So if we can get a poll up and going once you've had a chance to review the updated wording on these questions for this survey, would that be acceptable? Okay. So that will be the plan, and luckily for us, Diana is really, really good with, taking care of this stuff.
To clarify my part, do you want a poll where it's on the email one question, you want to send the survey, you don't, or do you all want to create a Google form that allows questions about, like, do you just want a yes or a no poll?
I think that we want a yes or no poll because, like I said, the Chase Committee's worked really hard. I think we've spent a lot of time discussing it, and I think that we've
heard some very valid points.
Great points, some great ads, and so I think that if you trust the fact that we've heard what you're saying and that we're willing to tweak where we believe it does need to be tweaked. It's going to be a yes or no.
Is there any reason not to just vote now and do a poll later? I mean, do we want to wait and see the edits first, or do we want to just say based on our feedback?
The poll should include the proposed survey.
Right.
Yes.
With the edits.
Yes, with the edits. The poll would be a yes or no with the edits.
Okay, so to clarify, when we have the final edits, both from research, from the notes that you've taken today, because remember, research is weighing in as well on the process and all of that. So when that is shared with all of SHAC, on that email will be a poll of yes, proceed in asking the board for approval to do the survey or no. Is that correct?
Correct.
That's correct.
And again, even if we get everybody's approval to move forward, when we present it to the board, if the board doesn't give us permission, then, it doesn't go anywhere beyond, the public meetings at that point. Any other questions on this topic before we start to wrap things up?
Let's.
Because it is getting close to time.
Thank you.
Upcoming events and announcements. It's Time Texas Challenge runs through March 5th, so make sure, totally, that you have signed up for that. Let's keep NEISD and San Antonio at the top of everything on that list. The NEISD Elementary Showcase of Stars is March 7th through March 8th. The PTA used book sale at the Blossom Athletic Center is for employees. This is a NEISD employees only sale. They get first dibs Thursday, March 23rd from 3 to 7. And then the doors will be open for the public Friday through Sunday, March 24th and 25th from 10 to 5, Sunday from 11 to 3. And does anybody else have any announcements or upcoming events? Melinda?
Hey, I'm Melinda. I'm also the advocacy chair for NEISD Council of PTAs. Monday is Texas PTA Rally Day, so I know all of you care a lot about public education. So we're taking a bus. Dr. Mike is coming with us. We're partnering with NISD to go down and participate in that event. So if anyone is interested in that, you can see me after and let me know. Thank you, Rachel.
Thank you, Melinda.
Bus to where?
Austin.
The Capitol.
Anybody else have any upcoming announcements? All righty. Tony?
Okay. So this meeting is now adjourned. It is 1:27. Standing committees will now break into work sessions.
I think we're out of time.
Or they can just wave at each other. Okay. Which are closed to the public. Previous standing committee Work sessions notes can be found on the NEISD SHAC webpage, once reviewed and approved by the standing committees. Thank you for your attendance, and we really appreciate all the discussion. Y'all have a good week.
Thank you guys so much. Appreciate it.
Hey, Sean, what class are you?
97.
Patrick Londo in class 92.
Nice job. What are you, you're just a guest here?
I'm just a guest here. I'm a parent. Got 9 children. So.
I got 2. God bless you.
God bless you.
I got 2 of them in A&M right now.
Sometimes 2's harder than 9 because they work together and play together and everything. So I got 2 at A&M as well. What years are they?
I got a junior and a freshman.
Okay.
So
freshman.
0 money.
Yeah, I understand. I've got 5 in college right now, so I understand. Oh, Shannon. Good. How are you? Are you? Hello. How are you? Good. Hello. Well, you got your ashes, and that's the right thing to do. Well, that's what I'm trying to find a place to talk about it. We'll have those conversations between the 3.
I watched it live outside.
Okay. Can you give me this? Which name? Mitch. Good. Yourself? I'm well. Good. Very good. Very good for the Ash Wednesday.